Hello, I am Carolyn Stephenson, co-owner and sales director of the Huntsville Event Magazine and the Huntsville Business Journal. Our hearts go out to all those who are suffering during this crisis. We want to take action to help individuals and businesses in our community in a safe way. This interview series will introduce you to the companies that partner with us to highlight so many nonprofits in our area and share local business news. I would like to introduce you to Dr. Pam Hudson, CEO of Crestwood Medical Center. Thank you for joining us today.
Glad to do it.
Could you tell me about your position as CEO at Crestwood Medical Center?
Well, as you might imagine, CEO of any company, and certainly mine as well, is the overall responsibility to lead our organization. And I have obviously some guiding principles that I keep in front of me and our organization aligned to make sure that Crestwood provides to our community safe, high-quality care. But I don't think that's enough. I think, in addition, we have to ensure an exceptional patient experience with that care so that they recognize that their care does meet the high-quality bar. Secondly, we collaborate and partner and support with our care team, which includes doctors, nurses, imaging and lab professionals, administrative folks, and many more. But perhaps the most important are our environmental services and plant operations team members, because a clean and well-maintained hospital is going to be a safe hospital where great care can happen.
Right. Now, how long have you been in the healthcare sector?
Almost 35 years.
Wow.
I'm a physician by training, and after medical school, I practiced for a little bit over a decade, and the last 20 years of my career has been on the administrative and management side of medicine. But I never feel like I'm very far from patient care. I communicate with patients all the time, and are very engaged with the quality of care that we're trying to provide here at Crestwood.
Right. And so what inspired you to begin a career in healthcare?
Well, as you might know, I'm a graduate of Huntsville High, and finishing up my high school years, I really wanted to focus my career and my education on ways to help people, and that's what inspired me to choose a college program that prepared me for medical school and family medicine residency, and helping people is what draws me to work every day as a physician and now as the CEO. In addition to the last 20 years of my focus being on how not only to take care of each patient, but how to help support and prepare a team to take care of patients. So I don't have one patient at a time anymore. I have hundreds.
Oh, goodness. Of course, one thing that has been on the news since the beginning of March has been just what we're dealing with today in terms of the pandemic with COVID-19. Could you tell me how the healthcare sector has been impacted by COVID-19?
COVID-19 has been, I guess, what we would call a significant disruptor in the healthcare sector. And like all businesses, the healthcare entities have been required to close. Hospitals have been instructed and required to limit the kinds of care that can be provided to emergency care. And similarly, physicians' offices and other entities have had to close, just like all other business. So, obviously that same revenue impact occurs.
Right.
But the second thing that, as we closed up all of that, we went into overdrive on working to respond to the care needs of the community. This was an intense planning, work redesign, and tremendous physical alterations to our building to assure the safety of patients, all patients who presented, but in particular to respond to the COVID threat. Thankfully, hospitals are required to have, and we do have, a strong framework in responding to disasters, and our state Department of Public Health also has that framework. And so all we have to do, not to minimize it in any way, shape, or form, is to take a look at what the current threat is and then make adjustments to what our underlying disaster approach is. So the difference with this was most of our disaster plans anticipate a scale that's more along the lines of a tornado or the flu season and that kind of thing. But this one is a bit different, a bit bigger, significant impact locally and then also regionally. So. And also the long-term nature of it. So keeping staff safe, obviously, for the long haul. This isn't a this isn't a sprint. It's a marathon.
Right.
Keeping staff safe and healthy is key to being able to continue to serve the community, and that was a huge focus in addition to the patient safety responses. And then the third thing that has been really a difficult thing for us to accommodate is the knowledge that normal patient care has been delayed and disrupted.
Right.
There's a great deal of care that, while it wasn't emergent or urgent, it was certainly necessary, essential care, and patients have put those things off. And of course now we're seeing some rebound of that. But during the early weeks, we saw patients who ended up coming in critically ill from non-COVID disease impact that they tried to stay home longer than they should. So.
Okay. I feel like maybe there was, I think it was confusing for the public as to if you feel sick, do you stay home and try to heal, or should you go to the hospital? I think there was a little bit of confusion there as to what was the right action to take. And like you said,
and I think that is an excellent point, and one that we initially, trying to encourage people to come in if they were sick, but if not, we were in a shelter-at-home situation. And I think that the hospitals have done an awful lot of work to make sure that patient care would be safe. We have separated the COVID and non-infectious populations of patients really from the moment you enter the door. We do less face-to-face and more telephonic type interactions with patients and families, and we currently are still under a no visitors rule, but trying to redefine what a patient support or caregiver is so that they can have patients can have an advocate with them, and so there's a number of special measures that we have taken and refined over time. That and making sure that our messaging to patients is don't delay care. It is safe here, and currently in our community, we've been very fortunate to have not very much hospitalized patients, not very many hospitalized patients, and so we have been able to carry on, to resume care, and take care of everybody, and to do it very safely.
Right. Now, that's a great way of explaining how you've had to take special measures and adjust the way that you operate. How has your position changed during the crisis? Has it changed?
For a while, seemed like advice and regulations that were changing almost hourly. So the position itself and the responsibilities haven't changed. How we've executed and how I've had to reapportion my days has changed substantially.
Okay. Now that Alabama is slowly reopening, what has changed for Crestwood Medical Center?
Well, some of the straightforward logistics have changed. We're doing universal source masking for all of our staff, no matter where in the building they are. We're asking patients and support persons to do the same. We have resorted to telehealth, as have most everyone in healthcare, and doing more things telephonically, and then the processes, and in healthcare, I like to think of a healthcare episode as being a very carefully choreographed dance that includes the patient, it includes all the care team that come to the bedside, and also the support people that are surrounding it. And really what's had to happen in all hospitals is the elements of that dance. The steps have had to be rearranged, lots of steps rearranged, still providing the same great outcome, but the habits and the ease with which those things have been performed for years and years, it had to be reworked, and I'm happy to say and proud to say that our teams have responded very well to that, and the new processes are working smoothly, and I think that patients in our community have been very gracious to continue those strong public health measures and help us re-engineer how we're providing the bedside care.
What does the future look like for Crestwood Medical Center? Do you feel like this is going to be our new normal, or what are your thoughts on that?
Well, I think that when I wrestle with that question, I'm first of all so glad that we are in Huntsville, Alabama,
right,
with an innovative community, a community of great leadership, and leadership that's committed to being ready to change. And I think that that certainly sets the stage for everyone who's in this community to work better as we deal with the new normal. Crestwood is a strong hospital. It has a great employee team. We have fantastic physicians in this community, and many of whom, in fact, most of whom are independent. So they are also businessmen and women who are leading teams. And so I think the future of healthcare and the future of Crestwood in this community is strong. Will it look like it does today? Probably not. I think we'll move through this pandemic over the course of months and perhaps a year or so to have a healthcare system that's going to continue to serve this community, because it's really an awful lot about the people who serve, and I have great faith and confidence in them, and also just am so grateful for the support that we have as healthcare providers received from our community. We've had donations of masks and people making those contributions, folks that provided food to our staff when we were seeing the first surge, and all the time, all the thank yous that people took the time to send an email or send a card or express their thanks in other more public ways. The Park and Pray has been just fantastic, and I can't thank the city leadership and county leadership enough. They've been rock steady, thoughtful, and kept a good focus on public health, and that's how our healthcare system and our community will get through all this.
Well, I appreciate you providing insight to all of us regarding your position at Crestwood, and telling us, a little bit more about what it's like to be on the inside of the hospital. And I really do appreciate your time today. Thank you so much, Dr. Hudson.
Well, you're very welcome. I appreciate the opportunity.
Thank you.